9.2. Is that normal for you? Okay. And when did you last take your blood sugar reading? What was the latest blood sugar reading this morning? I'll put that down. Put some there. I think what we need to do is get you referred for a full blood count, and we'll just check your most recent blood sugar levels, because that's a little bit elevated. I'll write it on here. So do you normally have blood sugars at 12 or above? Sometimes like increased blood sugar levels can be an indication of like an infection, but it might not be. It might just be like a little bit of an anomaly. But I will get a blood test organised for you just to check that, just to make sure that there's no infection. We'll check your what we call the white blood cell count, just to make sure that there's no infection. I'm just getting that sorted out for you, just to make sure everything's okay. I mean, if there was a little bit of an infection, I can't see, looking at the wound, that there's like any clinical signs of infection. Like there's no redness, there's no swelling. You've said to me that there's no pain. The pain's decreased since you've had the surgery and since you've had your stitches out. There's no exudates. The exudate looks quite clear, it's quite clean. So I don't suspect that there's any sort of signs of clinical infection, but sometimes blood sugars can increase during infection. So we'll just check it just as what we do routinely. You know, I'm not concerned that there is any infection, and if there was an infection, we can treat it with antibiotics. But just in the meantime, just keep an eye out on like redness, pain, swelling, heat, and increasing temperature. Any redness that moves from this area of the wound, like any lines tracking from the wound, just keep an eye out. Any redness around the area, just keep an eye out for that. And of course, if you do see anything like that, come and see us. Okay, so what I'm going to do, I'm just going to give it a little bit of a clean. Excuse me. Might be a little bit stingy. When did you last eat anything? When did you last have anything to eat? And since you last ate and then you checked your blood sugar levels, how long in between was that? So you ate some food and then you checked your blood sugar levels. Might be a bit stingy now, I do apologise. When was it that you last checked your blood sugar levels? Was it like an hour later, or was it straight away? Because usually we recommend to patients to sort of wait for, half an hour, 40 minutes or so after they've eaten to check blood sugar levels. Because if you check your blood sugar levels straight away after eating, it's usually quite raised, and we would consider that a void result. You okay? Sorry, it might be a bit stingy. I mean, just looking at this, there's not really much coloured exudate, that's weeping, that we would normally see on a wound dressing. So I'm not like concerned of any infection. Just dab it and dry it for you. let's get a little dressing on that for you, and then we can get on to the other assessments. What I'm going to do is I'm going to give you a few of these room swabs, okay? What I'd like you to do is just take the dressing off after 2 days, just 2 days, and just redress it, just bob a spare dressing on. I'll also cut you out a little bit of tape. You're not allergic to anything, are you? Good. I'll give you this and then cut you out a little bit of this tape. All I want you to do, after 2 days, take the dressing off and then just bob a dry dressing on and just check for any weeping, any discoloration, like I keep saying, redness swelling. So I'll give you that, and then you can do that yourself just to make sure the wound stays nice and dry. But in the meantime, I'm just going to put you just a dry dressing on and a little bit of tape. And then if you need any more dressings, you can either buy them from the chemist or just let us know and we can give you some more. It's not a problem. Make sure when you take your blood sugar levels that you do it. Usually we advise patients to wait about 40 minutes to an hour after they've had their last meal. So say for example you have your breakfast in the morning, we would normally advise people to wait like 40 minutes to an hour to check the blood sugars, and that usually gives people a more accurate representation of what their accurate blood sugar level is. So this is the easy part now. Might be a little bit tender, I do apologise, just bear with me. Okay. Any pain? Good. Okay, great. Just make a note of what we've done. Come on, computer's running slow. So put on a dry dressing with Mefix. So patient advised to redress wound after 2 days. So what I'd like you to do is to keep that on and try and keep it as clean and dry as possible. I know it's really awkward to do that, but try and just like bathe with just a cloth if you can. I know it's really awkward to do that, but try and keep it as clean and dry as possible. And I know I'll keep saying it, but it's important. Just check for any redness, heat, pain, swelling, any increase in temperature. So if the area gets warm, check for redness, heat, pain, and swelling, / increase in temperature. And then if you notice any of these signs, they could indicate the signs of infection, so do contact us if any problems arise. Patient advised to contact us SOS should signs of clinical infection occur, such as pain, swelling, reiterated in conversation. And do you have our contact details at hand? Okay. Patient, GP practice, contact details at hand. Okay. And also what I'd like you to do is just keep an eye on your blood sugar levels as well. So do check them, like I said, 40 minutes to an hour after you've had your last meal. So don't do your blood sugar check, like your finger prick check, straight away after you've had a meal. Check them like 40 minutes to an hour after. And let us know if it like increases or it spikes up like randomly to like a high level, like 15 or above. Patient advised to check glucose levels 40 mins to 60 mins post meal. Advised to contact us should blood glucose spike. What's the word I'm looking for? Spike, or increase out of usual ranges for another FCC, full cell count, white cell count I should say, FCC, white cell count, and a full blood test, which we'll be doing anyway. I will get a range of bloods sorted for you just so you can check your white cell levels. Okay, so that's the worst bit over and done with. And I hope that wasn't too bad for you. Do as well, I've just thought I'm going to give you this antiseptic, just give it a shake. I'm going to give you this antiseptic solution, and it smells a little bit, I do apologise, but just take this. You have to, it's got a child cap on it obviously for safety, but just take this. It smells a little bit, it smells like stinks. You have to just, if you notice any redness or swelling that you're worried there might be an infection in there, just bob that just a tiny bit on the dressing. Before you put the dressing on, it might just sting a little bit, so I'll just leave that over there for you and you can take some of that. Right, okay, now we've done that, worst bit over and done with. What I'd like to do is check just a few things, like I'd like to check your heart, and I'd also like to check what your pulse is doing, your heart rate. I'd like to check your lungs, and I'd like to do just a few checks if that's okay. So while I'm doing this and just writing my notes up, if you can just take off your top undergarment, you can leave your top overgarment, I should say, you can leave your undergarments on underneath. So given Here we are. Should any signs of infection occur, to apply to dressing and seek advice ASAP. Okay, right. So, what I'm going to do first is I'm just going to check your heart and make sure that's okay. So, this might be a little bit cold, I do apologise. Right this side, sorry. If you can just lift your arm up for me like this. And lift this arm up for me. Okay. And then if you can just turn around for me, because I'm just going to check your breathing. So that seems all okay. Come on. Slow computer day. Okay. And I'd like you to take a deep breath in for me and out. Take a deep breath in and out. Take a deep breath in and out. And the last one, take a deep breath in and out. Okay. And while you're there, don't turn around, don't turn around. I'm just going to tap on your back, okay, because I'm just listening to something called consolidation, which is just if you've got any signs of lung infection or any fluid build-up. Okay. Marvellous. So you can, yes, you can put your, actually no, leave your, you can turn around, but you can leave your undergarments on if you don't mind, because I just want to check your blood pressure. So, no signs of consolidation. Alright. No ectopics detected. No abnormal arrhythmia. Okay. Just going to check your blood pressure now. So if you can just do me a favour and just pop your arm out for me, just like this, just so I can get to this area here. This is going to get a little bit tight. I do apologise. Not the nicest sensation. I do appreciate that. Okay, just rest your arm down on the table for me there for me, that's it. Great. takes a minute. It might get a little bit tight. I do apologise. Okay. Let's take that off for you because I know it's a little bit on the tight side. I do apologise. Seems fine. That's okay. All hunky-dory up to now. And then the last test I'm going to do is it's called a pulse oximeter. So okay, this just goes over your finger. So I want you to put your finger out like that for me. It just goes over your finger this way. It just goes over your finger, and it just tells me what your pulse is doing and what your oxygen saturation is. Okay, so just pop your finger out for me. So it just takes a minute. So your oxygen saturation is really good. That's 98%, and we'd expect like a normal oxygen saturation to be from 95 to 100%. Roundabout. Yours is 98, so that's really good. Spot on, bang on, fine. I don't think there's any signs of infection there. Your blood pressure's okay. There's no signs of redness or swelling in the wound area. Blood pressure's fine. Oxygen saturation's fine. I think we're a bit hunky-dory, to be honest. So let me just write that down. Infection, pressure, normal. O2 sounds normal. Heart rate normal. And you feel well in yourself. You don't feel like flu-like symptoms. You don't feel like nauseous or sick or anything like that. And you're eating okay. No flu-like symptoms. No obvious signs of sepsis. I think we're doing okay, to be honest. I think we're doing okay. Brilliant. The wound site looked okay today as well. The last thing I'm going to do, I'm happy with everything. I'm just going to have a little look at your prescriptions, if that's all right. Just make sure that everything's okay, that you're on the dose and everything. I'm quite happy with that, to be honest. This, the wound site's looking really good. Your pain's decreasing. No signs of infection. I think what we'll do is I'll get you referred for a blood test just to make sure that the white cell count isn't elevated, just to rule it out. It's just like a routine test that we do for everybody. But what I'd like you to do, keep that dressing on clean and dry for 2 days, redress it with the dressing I've given you. If you can see any signs of redness, heat, pain or swelling, bob on a little bit of that antiseptic ointment, the clear fluid that I've given you. Just on the dressing, bob that on, it might stink a little bit. keep that on until you next come and see us. Try and strip wash if you can. I know it's a pain in the bum sometimes, but we shall see you. Just having a little look when my next appointment is. That will be next Thursday at 4:10 p.m. Is that alright with you? Perfect. Let's just book that in for you. Just have a look at what your full name is. I forgot. My memory's like a sieve. And date of birth. There we are. Got it. Super. That's all booked in for you. If you need a reminder, just ask reception. She'll print out a little form for you. But other than that, to be honest, I'm happy with it. It's going really well. I'm glad that the pain's reducing. Any problems, come and see us. But do you know what? I think we're going to be absolutely fine. Any worries, concerns, complaints that you've got today? Perfect. Okay. See you next time. Bye. Cheerio. Ta-ra.